By age 3, 80% of dogs already have active dental disease. Not the early kind you can ignore, the kind where bacteria have already entered the bloodstream and reached the heart, kidneys, and liver. Most owners have no idea. Their dog acts fine, eats fine, plays fine, because dogs don't show pain the way we do. They push through it, silently, every single day. And that's the pattern we're going to talk about today. 15 things that hurt your dog. Not dramatically, not obviously, but slowly, cumulatively, over months and years. Things that look harmless. Things most owners do without ever questioning them. By the end of this video, you'll see your dog's daily routine completely differently. Stay to the end and you'll learn why where you put the water bowl might be slowly dehydrating your dog. Why your floor cleaner could be poisoning your dog one paw lick at a time. And why the dogs that live the longest are the ones whose owners got a few very specific, very unsexy things right. Tap the like button right now before we go further. I'm serious. You haven't seen the video yet, but I know what's in it and it's worth it. If you disagree at the end, you can't take it back. That's just how it works. Let's start with the most basic thing imaginable, going to the bathroom. Your dog needs to urinate. This is not complicated. And yet, millions of dogs spend 8, 9, 10 hours a day with a full bladder because their owner is at work. Most healthy adult dogs can technically hold it that long. The key word is technically. The fact that they can doesn't mean there's no cost. Veterinary research is consistent on this. Chronic urine retention dramatically increases the risk of urinary tract infections because bacteria have time to multiply in the stagnant urine. Long-term, it increases the risk of bladder stones, kidney stress, and in older dogs, bladder incontinence. There's even emerging evidence linking prolonged urine retention to elevated risk of certain urinary cancers because carcinogens sit in contact with bladder cells for hours at a time. Small breeds, senior dogs, and dogs with any existing urinary condition are hit hardest by this. The fix is not complicated. A midday potty break, an indoor grass pad, a doggy door if possible, freedom to eliminate when the body says it's time. That's not a luxury. That's basic physiological dignity. Now, here's something that sounds almost too small to matter. Where is your dog's water bowl? If it's right next to the food bowl, you've accidentally triggered an ancient instinct. Dogs have hardwired behavioral responses inherited from wild ancestors, and one of those responses is the association between food and contaminated water. In nature, water sources near decomposing food or prey were frequently unsafe. So the instinct is, water close to food smells wrong, and the dog drinks less. Less than they need. Chronic low-grade dehydration isn't dramatic. It doesn't look like a panting, thirsty dog. It looks like a dog who drinks a little less than they should, every day, for years. The cumulative effect on kidneys and joints is significant. The fix? Move the water bowl at least 6 feet from the food. Add 2 or 3 water stations around the house. Use stainless steel or ceramic, not plastic, which can harbor bacteria in microscopic scratches. A pet fountain that circulates water can dramatically increase how much a dog drinks because moving water triggers the same instinct as a stream. Change the water at least twice daily if you don't have a fountain. We've covered the bladder and the water bowl. Now let's talk about something that's killing dogs silently and is completely invisible. What's on your floor? Common household floor cleaners, products containing phenols, bleach compounds, and certain surfactants, leave a chemical residue after mopping. Your dog walks across that floor. The paws absorb it. The dog licks the paws. This happens every single day. The liver processes these compounds, but it was not designed to process them continuously at low doses over years. The signs of chronic low-level chemical exposure are frustratingly vague. Lethargy, occasional vomiting, constant paw licking, watery eyes. All things owners attribute to allergies, stress, or just the dog's personality. Closely related is the essential oil problem. Dogs process scent 40 times more intensely than humans. Tea tree oil is toxic to dogs' nervous systems. As few as 7 drops of concentrated oil can cause severe neurological poisoning. Clove oil causes central nervous system depression and liver injury. Eucalyptus, cinnamon, the same category. Diffusers fill the air with these compounds constantly. The fix is straightforward. Enzyme-based pet-safe cleaners for your floors. Wipe with clean water after mopping. No scented candles, no plug-ins, no carpet sprays in dog areas. Open windows. Charcoal filters. And while we're inside the house, let's talk about temperature, something almost no one thinks about. Most dogs thrive at about 24 to 26 degrees Celsius, which is roughly 75 to 80 degrees Fahrenheit. When humans are comfortable at 19 or 20 degrees, which is what most thermostats are set to, small breeds, seniors, and short-haired dogs are cold. Not hypothermic cold, just persistently, chronically, slightly cold. And cold hits joints first. In a dog already predisposed to arthritis, chronic mild cold accelerates joint inflammation significantly. Cold also slows circulation, digestion, and immune function. Puppies can't even regulate their own body temperature properly. The fix? A warm blanket at every sleep spot. A safe, low-setting heating pad under the dog bed. A fleece jacket for morning walks in winter. Keep them off cold tile floors when possible. Now let's go from temperature to something that affects your dog every single time they eat. Bowl position. Most dogs eat from a bowl on the floor, which means at every meal, they crane their neck forward, curve their spine, and hunch their shoulders. Do that yourself right now and hold it for 5 minutes. That's 365 days times 2 meals of low-grade strain on the jaw, neck, shoulders, and digestive tract. Signs that a dog is uncomfortable eating. They hesitate at the bowl, shift their weight between front legs, eat half and walk away and come back. Now, and this is important, the research on elevated feeders is genuinely mixed. For small breeds, senior dogs, flat-faced breeds like bulldogs and pugs, and dogs with neck or spine conditions, an elevated bowl aligned with chest height can significantly reduce mealtime stress. But for large and giant breed dogs, Great Danes, St. Bernards, Irish Wolfhounds, research from Purdue University found that elevated feeders may increase the risk of bloat, a life-threatening twisting of the stomach, by up to 110%. So the rule is not elevate everything. The rule is, if you have a large or giant breed, do not elevate their bowl. If you have a small breed, senior, or flat-faced dog, an elevated bowl can genuinely help. Know which category your dog is in. You're about halfway through. What's coming next is the category that quietly shortens lives by years, and it's about things going into the body. We start with weight. 2 pounds overweight on a small dog is the metabolic equivalent of roughly 20 pounds overweight on a human. The 2019 Journal of Veterinary Internal Medicine study, the largest of its kind, looking at more than 50,000 dogs across 12 breeds, found that overweight dogs live up to 2.5 years less than dogs at healthy weight. Not a minor difference. For a Yorkshire Terrier, the difference between normal weight and overweight was 13.7 years versus 16.2. That gap is 2.5 years of life. Gone. The mechanisms are joint damage, heart strain, insulin resistance, fatty liver, and a chronic inflammatory state that accelerates every other disease process. The fix is exact measurement, not a rough scoop, a measuring cup or digital scale every meal. Treats capped at 10% of daily calories. When your vet says your dog needs to lose a pound, take it as seriously as you would if your own doctor said you needed to lose 20 pounds, because that's precisely what it means. Connected to weight, commercial treats. Most commercial dog treats are loaded with salt, sugar, corn syrup, artificial flavoring, and fillers. 10 extra treats daily adds up to 5 to 10 pounds of excess weight per year. More insidiously, dogs who receive rich treats regularly start refusing meals and holding out for the treats instead, which means they're eating more processed, lower quality food than their regular kibble. The fix: single ingredient freeze-dried meats, carrots, green beans, plain rice cakes, or just pieces of the dog's own kibble, treated as a high-value reward because of the delivery, your voice, your energy, your eye contact. Praise is more powerful than most owners realize. Chewing is not destructive behavior. It is therapy. Chewing is how dogs self-soothe, decompress, and relieve jaw tension. A dog that chews the wrong things, furniture, baseboards, shoes, isn't misbehaving. They're doing exactly what their body needs to do, with whatever's available. Wrong toys, the kind that are too small, too hard, wrong texture, no scent, get ignored. The dog goes for the sofa leg that smells like the owner and gives satisfying resistance. The fix? Toys matched to breed, age, and jaw strength, rotating them weekly because novelty matters. Frozen Kongs packed with peanut butter or wet food. Natural chews, bully sticks, yak milk chews, beef tendon. One chew toy placed at every regular rest spot, so the option is always there. Now, the category most owners get completely backwards: mental stimulation. A dog left alone indoors all day with nothing to do will develop coping patterns. Not bad habits, coping patterns. Excessive licking, tail chasing, barking at shadows, pacing at night, chewing walls. These are not personality quirks. These are behavioral responses to chronic understimulation, the dog equivalent of a person going a little strange after months of solitary confinement. Over time, mentally understimulated dogs stop wagging when you come home. They lose eye contact. They go quiet in a way that isn't calm. It's withdrawal. The fix is 20 minutes of real mental engagement daily. Puzzle feeders. Scent games where you hide treats around the house. A new walking route that exposes them to new smells. One new command per week. The brain needs exercise as much as the body does, arguably more. Related, loneliness. Not just boredom, actual loneliness. Dogs are social animals who co-evolved with humans over 15,000 years. Being left alone for 8 to 10 hours a day is genuinely stressful. Cortisol spikes chronically. Immune function weakens. Dogs who experience chronic loneliness begin to show signs that overlap with clinical depression in humans: loss of appetite, reduced energy, reduced engagement, less interest in play. The fix is 20 to 30 minutes daily of focused engagement. Not just being in the same room, but tug of war, trick training, massage, deliberate eye contact. If you're away long hours regularly, a dog walker or doggy daycare isn't a luxury, it's healthcare. Now, the hardest mistake to see, because the dog never tells you: mouth pain. By age 3, 80 to 89% of dogs have active periodontal disease. The figure is from veterinary research. It's not a scare tactic. Periodontal disease means bacteria living under the gum line, destroying tissue, eroding bone. The dog keeps eating because the alternative is starvation, and food drive overrides pain response. Signs that something is wrong: drooling more than usual, extremely bad breath, chewing only on one side, occasionally pawing at the mouth, eating slower, turning away from hard food. When dental bacteria enter the bloodstream, which they do regularly once disease is established, they travel to the heart, kidneys, and liver. The connection between dental disease and organ damage in dogs is well documented in veterinary literature. The fix? Brush your dog's teeth daily, or at minimum 3 times a week, using dog-safe enzymatic toothpaste. Dental chews can help. Water additives can help. Professional cleanings under anesthesia when your vet recommends them. This is not optional maintenance. This is organ protection. 2 more. First, reproductive health. For unspayed females, the risk of pyometra, a life-threatening infection of the uterus, is striking. Research shows that by age 10, approximately 25% of intact female dogs will develop pyometra. It can progress from first symptoms to organ failure within days. Spaying eliminates this risk entirely. For mammary tumors, spaying before the first heat reduces the risk of mammary cancer to approximately 0.5%. After the first heat, that risk rises to 8%. After the second heat, to 26%. For intact males, testosterone-driven behaviors, relentless marking, roaming, aggression, are chronic stressors on the body and the household. Testicular cancer and prostate disease are real long-term risks. The myth that spaying or neutering fundamentally changes the dog's personality is not supported by research. What changes is the hormonal surge driving certain compulsive behaviors. The dog's core character remains. The last mistake is the one that sounds the most abstract and causes some of the most concrete damage: schedule. Dogs' brains run on predictability, not as a preference, as a biological need. Their digestive system, stress hormones, and sleep cycles are all calibrated to recurring patterns. Random feeding times, inconsistent walk times, unpredictable schedules create chronic, low-level biological panic. Cortisol elevates. The dog becomes nervous, reactive, prone to accidents, prone to compulsive behaviors. Every time you skip the morning walk at the usual hour or feed dinner 3 hours late, the dog's nervous system registers it as a signal that something is wrong. The fix is the least expensive intervention in this entire video. Feed at the same 2 times every day. Walk at the same hour every morning. End the day with the same evening routine. Consistency isn't rigidity. It's the language your dog's body speaks. Every skipped routine chips away at the baseline trust their nervous system has built around your presence. Here's what all 15 of these mistakes have in common. They're not dramatic. No single instance is a crisis. They accumulate over months, over years, into shortened lives, chronic discomfort, behavioral problems that owners blame on the dog's breed or temperament, and illnesses that seem to appear from nowhere. None of this comes from cruelty. It comes from not knowing. The dog can't tell you the water bowl is in the wrong place, can't tell you the floor cleaner is affecting their liver, can't tell you their teeth have been hurting for 2 years. What separates the dogs who live 15, 16, 17 years from the ones who struggle to reach 11 isn't expensive food or elaborate medical care. It's owners who noticed the small things, the patterns, the quiet signals. It's people who paid attention. Which of these 15 surprised you the most? Tell me in the comments. And if your dog is currently doing something, sleeping nearby, chewing something, demanding a walk that's overdue, go take care of that right now. This will be here when you get back. Subscribe or the dog gets it. Not harmed, obviously, but they've been instructed to sit directly on your face while you try to sleep until you click the button. They know where you live.